honored guests of the procession, students, parents, colleagues, ladies and gentlemen. Today marks the 99th day of my headship tenure. According to conventional wisdom, my 100-day honeymoon is about to expire. So before the clock strikes at midnight tonight, turning me back into a pumpkin, I feel obliged to report to you progress on some new initiatives the department has set out to achieve and to lay out our vision of academic public health for the year ahead. First, allow me to chart the landscape in which we find ourselves, then explain our strategic response as an academic enterprise. In the world, September 2011 was a watershed for public health when the United Nations convened a health summit of presidents and prime ministers for only the second time in its history to discuss a way forward tackling the grim urgency of non-communicable diseases, or NCDs in short. In the country, reform and opening up since 1979 has proved to be the most successful poverty reduction experiment in human history, although the attendant social and more specifically health costs are considerable. Such unprecedented pace and magnitude of economic development offer a unique scientific opportunity to understand fundamental biological pathways of NCDs through careful epidemiologic dissection of disease patterns at the population level. In tandem, there is a public health imperative to identify and of greater import, act on major modifiable determinants of these chronic complex diseases and to decide how best to pay for such interventions. In Hong Kong, the Department of Health's Strategic Framework for Prevention and Control of Non-Communicable Diseases, launched in 2008, has given much impetus to work against NCDs in the local public health community. I was most encouraged recently by the Director of Health's clear and firm answer when I asked about her priorities on taking up office. She responded with 3 simple letters: NCDs. At the same time, the unfinished epidemic of infectious diseases continues to pose more immediate and apparent threats. Hong Kong has, of course, lived with this reality with the 1997 H5 outbreak, SARS in 2003, and pandemic H1 in 2009 etched in recent memory. Not to mention the familiar influenza, RSV, and hand, foot, and mouth seasonal epidemics, as well as the many ad hoc challenges in between, from a new variant coronavirus coming out from the Middle East to iatrogenic contamination by Mycobacterium abscessus in a local beauty chain recently. In response, we will be reorganizing our research activities into 2 broad clusters, namely influenza and other infections of global health significance and non-communicable diseases in global health. These will bring into sharper focus the scientific and public health motivation to the many excellent programs already in place. For instance, the department's long-standing flagship in tobacco control will be joined by the team looking into the etiological role of alcohol in NCDs. These projects examining lifestyle determinants of diabetes and cardiovascular disease will in turn be complemented by research into novel hypotheses based on a socio-historical perspective of life course epidemiologic theory, drawing on the different major cohort studies and biobanks in the department in collaboration with our partners, including the Department of Health and the Guangzhou Health Bureau. Another strand of work in the NCD cluster would see the widely acknowledged psycho-oncology team working together with colleagues in health economics to develop multimedia decision aids for cancer care. The Jockey Club-supported Family Project has just begun its harvesting process, having toiled and labored for 5 years in improving our understanding of individual and family health, happiness, and harmony writ large Hong Kong society. You will be hearing much more about our exciting findings in both the scientific and lay press. The coming together of our other research clusters specializing in influenza and other infections of global health significance has scored a historic milestone where there is truly seamless bench to population impact to its work. The Center of Influenza Research, an RGC-funded area of excellence, brings under the same institutional roof wide-ranging disciplinary expertise in ecology, evolutionary biology, veterinary science, clinical medicine, epidemiology, biostatistics, and mathematical modeling with the single common objective of keeping influenza in check. I hope this will be the first of several major research programs where laboratory science and the population sciences join forces to tackle the most vexed public health problems of the day. In addition to better aligning ourselves to deliver world-class research, the department is in the process of undergoing a structural transformation with the School of Public Health. This will bring the organizational infrastructure that has remained largely unchanged since the department was established in 1950 to a new platform that is fit for purpose. The Behavioral Sciences Unit, Medical and Health Research Network, Center for Influenza Research, including the Hong Kong U Pasteur Research Center, and Public Health Research Center will all become part of the newly consolidated School of Public Health. After the process is complete, we will emerge with 5 academic divisions, namely Behavioral Health, Community Medicine and Public Health Practice, Epidemiology and Biostatistics, Health Economics Policy and Management, and Public Health Virology. We will have a combined strength of 65 academic-related and teaching faculty, and a total staff establishment of over 260. I'm pleased to report that the university has approved plans to relocate the Cyberport campus back to Sassoon Road at the Patrick Manson building, which used to house the medical library and the faculty office. We're now fleshing out renovation plans that will preserve heritage features of the building while outfitting it with the latest amenities to make it a pleasant and productive work environment. After the move, all offices and laboratories of the school will be located on either side of Sassoon Road. The symbolism in the School of Public Health returning to the Patrick Manson building cannot be more apt. Patrick Manson was not only a founding father of our medical school, he also established the London School of Hygiene and Tropical Medicine and is more generally revered as a public health icon. In teaching, we continue to offer our flagship Master of Public Health program, which is graduating 83 students from 8 countries today. Cumulatively, since the program began over a decade ago, 576 alumni have graduated, some of whom are already in leadership positions locally and on the mainland. This year, we have selected through a highly competitive admission exercise 106 new students from 10 different places to study with us. In the current academic year, we have revamped core modules in epidemiology and biostatistics, refreshed courses in health policy and health systems, and found new ways to engage students in a whole class format. We will be working on closer networking with our alumni and in providing more personalized career guidance for our graduates. We have also begun a new core sharing initiative with the Chinese University Jockey Club School of Public Health and Primary Care to better pool scarce resources and expertise in the territory. Every year we admit about a dozen new research postgraduates who form the very lifeblood of our research projects and will hopefully become the next generation of principal investigators. Having served in government during the last 4 years, they were the ones whom I missed the most. They provide the energy, ask the most innocent yet probing questions, challenge orthodoxy, and above all, constantly push us all towards the next frontier. I salute those whose success we are here celebrating this afternoon. One member of this graduating cohort has already worked in the past 6 months with the US CDC and Abuja, Nigeria, while another is considering helping those in abject poverty in Filipino slums in the coming year. Yet other graduates will be returning to public health jobs or joining some of the world's best laboratories. An exciting future awaits. On knowledge translation, I should like to take this opportunity to re-emphasize the importance our department and school attach to putting research into practice by once again congratulating Professor Sophia Chan, inaugural Deputy Director of the Public Health Research Center and a PhD graduate of this department, on taking up appointment as Undersecretary for Food and Health. Together with the former Secretary for the Environment, Dr. Sarah Liao, and yours truly, our department has possibly produced more government ministers since 1997 than any other individual university department in Hong Kong. On the topic of policy links, our longest-serving honorary professor, come guest of honor today, Professor Judith Mackay, is, as I speak, receiving an audience at the Central Party School in the capital, advising the nation's top thinkers on tobacco control. We will therefore be sharing in Judith's wisdom by video presently. It remains for me to thank the procession members, especially all of our partners from the different health and healthcare professions, as well as representatives of the Alliance of Patient Groups, who share in our common vision for better population health. Finally, I'm most grateful to my colleagues on the faculty, all brilliant in their own ways and absolutely dedicated to protecting and improving public health through discovery and dissemination. They are the very reason we have a department and a school. In fact, they are the school. To further strengthen our core and to plan for the future, we will be launching a major search exercise that will continue for the coming few years to find the best minds from anywhere in the world, including here at home, who share our passion in public health and would complement our efforts in research, teaching, and service. Let me close by sharing a quote from 1887, 125 years ago, that rings true to this day, as applicable to the inauguration of the Hong Kong College of Medicine for Chinese then, as to the celebration ceremony of the School of Public Health today. The old Greek cities used to boast of the great men and women and claim them with jealous care. Let us hope that in the new and greater China of the future, when the learned dispute of the great men, not a few may be claimed for Hong Kong and for the school. Godspeed, graduates. May you fulfill these words by Patrick Manson 125 years ago. Thank you very much.